Well, good morning again. This is Dr. Bill Wyatt with the American Orthodontic Society, and we're getting this video started off as kind of a bad example here, but anyway, we want to talk about orthodontics from the cradle to the grave. In other words, from the time we were born, you can have your teeth straightened any time during your life, even up into your 90s. So let's get going from this point on here. All right, you can have orthodontics done all your life. And so let's get going. There's a story here that I must tell you that some people might think you're a racist because of it, but my wife and I went to Africa as missionaries, and we went when our children were quite young. It was back in 1961, and I was operating a dental clinic in Ibadan, Nigeria, and I had a lot of American, Afro-American people that were working in the government there in Africa. We had one special family, the Pages, I believe their name was, and they came in as patients, and they had two daughters. These were not total African people, either one. They were a mixture. They had some Caucasian blood in them. In fact, they were as light a complexion as I would be if I were tanned or something like that. But yet we called them black. Now they had two daughters. The older daughter was very light complected, but the younger daughter, which had a beautiful personality and everything, was darker than her mother or her father or her sister. And this kind of bothered her, and we were looking at her teeth to straighten them. And we just couldn't figure out a way that you could possibly put the teeth in the Caucasian structure that this young lady had. Now, so the teeth were extremely crowded, in other words. So in order to get the teeth into the structure, we had to remove the first bicuspids to start with, and later we still didn't have room enough. We took out her wisdom teeth also. And with 8 permanent teeth missing, we were able to put the rest of the teeth into the mouth structure where they fit. Now, I want to tell you that the ectodermal layer, when a child is born, this ectodermal layer that provides the skin also provides the teeth. So the teeth and the skin have the same ectodermal layer. Well, whatever genetics there is there, that where the person gets the skin more like one side of the family, and they'll have a tooth that's just the same as that size. So there was no putting this young lady's teeth in the bone structure they had, and so, or she had. Now, so we reduced the teeth, and we finally got the teeth in as she grew older, and we were able to put everything in there, but we took out 8 permanent teeth, and she still had a mouth full of teeth. She was not caved in the face. So that changed my way of thinking there, that people are mixed up. Here in America, we have people from every branch of life, every culture around over the world are here in America. and we get mixed up between one and the other. And if you get a person with a large tooth marries a person with a small facial structure, and their teeth get over into the small facial structure, there's no sense in trying to keep those teeth there. You need to reduce the teeth so that they fit the facial structure. And that's just a fact. And that's one big reason for malocclusions in America. All right, I have another story to tell about the African people there. When we went there, we put in 2 complete operatories in a dental clinic that already had 2 operatories in it, and we had about 10 or more young men work. We didn't hire women then. The men worked. Young men worked in the dental office with me, and we went to a school once. There was a church school, kind of a small town between Ibadan and Obomashaw in Nigeria. And we took all the boys there. We put stuff out there where they cleaned their teeth. They let us train these young men to clean teeth. And they cleaned all the teeth in the school. And I set up a fancy drill, an air drill that we had, and it had a light and a chair, and I did all the dental work and all the orthodontics work on every kid in that school. And there was probably 200 to 300 kids. I don't remember. They worked up to about 14 years of age there at this school. And I want you to know I had only 12 fillings to do in this whole school of everybody that went through there. And there was no malocclusion in there. I straightened everybody's teeth. All I had to do was take out one supernumerary tooth. And I did that. And the rest of them had beautiful class 1 maxillary protrusive faces and teeth, and everything matched up. These people had married and stayed in this same class of people for thousands of years probably, and their teeth fit the person right like that, and it was no problem. They never ate anything sweet in this particular village. None of these people ate. They never did make pie or cake. They just ate things that were not so sweet, and they had no cavities to speak of in that whole school. And so I learned something from that too, that this can happen. Now, why did the children of these African families have virtually no orthodontic problems like this? And one of them was that these children nursed their mothers from about 2.5 years to 3 years. If the mother got pregnant a year after she had a child, and she had a younger child that came along, this was very unusual. They would not stay with their husbands for about 2.5 years, something like that. And if they had a child earlier, they had a disease called kwashiorkor. That means the younger kills the older. So the young child would get the mother's milk, and the older one would be cut out, maybe after a year and a half, and he couldn't get enough protein there in the diet that they gave them. And so they would develop a huge stomach about the size of a watermelon. It was just really heartbreaking to see a child with this problem. And I had one picture of one but he was going away. He was embarrassed like this. So the mothers have to nurse the child, one child till he's about 2.5 to 3 years of age. Then usually they're able to eat enough to where they have enough protein in their diet to do this. And so this is a sad thing to have. And so I'm saying this, that in America, if the mother can't nurse the child for a long period of time, you just do not develop the maxillary structure properly. In other words, your maxilla won't develop, and your lower arch, and you'll breathe through your mouth, and the tongue lies in the bottom arch, and the bottom arch will get broader than the upper arch, and then you will go into cross bites and things like this, and you do not pick up the protective genetics, that the mother has. And I looked my whole career for somebody that had just perfect teeth, but had never had any orthodontics. And I was unable to find anybody during my whole practice time that had perfect teeth and had never had any orthodontics done. But I did not look at my own wife, whose teeth were perfect. And then I got to talking to my wife about this, and she said, well, they lived out into the Kisatchie National Forest while she was growing up and everything. They had saw very few people, everything, and she had nursed her mother for about 2.5 years, and she had perfectly class 1 occlusion, and she also had resistance to allergies. And even now, she's 91 years old, and I'm 95, and she's breathing without any problem. She doesn't have any allergies, and I do have the allergies. And my lower jaw is spread out bigger than my upper, and I bite my cheeks. So these two things affect people here in the United States. It's almost impossible for the mothers here who have to work or do different things to nurse their children that length of time. We have plenty of protein to feed the ones that are not fed by nursing like this. So there's a difference in people here in the United States. There are people here from every country, I believe, in the world. And we have a mixture, this uncanny, this of the way people are here. So this is the problem that I possess, and I want to present to you. Orthodontics can be done from the cradle to the grave. So some of this starts before birth, but it's hard for the person that's got it in the teeth to pick their parents out. So they just have to get whatever they've got, and then they have to go from there. Now, the other parts of this, they can straighten that out. So this is one part of the video here that I'm just going to talk to you, and I'm going to start in now on some other things here, showing some of the cases that we start early and we have to start doing something. So thank you for watching, and I'm going to close it out here today, and hope you'll tune in. We're going to have several things working on early treatment, real early treatment, and then medium early treatment, and then adult treatment or older, and then adult orthodontics, which goes back in these days. So I'm going to say goodbye, and hope that you get something out of this video now. Thank you again, and I'm going to close out.